This is the wrist joint, and we'll look at the bones of the wrist, the individual carpal bones. One of the first things to notice is we're looking at this in the palmar view or anterior view. Here we have the ulna and the radius. The primary wrist joint being the radiocarpal joint, where the articulation of the radius and the proximal row of carpal bones. So the radiocarpal joint is commonly referred to as the wrist joint. There is an ulnocarpal space, and there's a disc that continues along here and some ligaments that fill up that space, but primarily when we think of wrist joint, we should be thinking of radiocarpal. The other thing to note is that the radiocarpal joint is concave proximally and convex at the proximal aspect of the wrist itself. Most of our movements with the hand are going to be open chain movements, so you can see that this would be considered convex on concave movement. The second major joint of the wrist is what's called the mid-carpal joint, and this is just a loosely defined joint between the more proximal row of carpal bones and the distal row of carpal bones, and this is known as the mid-carpal joint. Mid-carpal joint.